Hi guys, this is Dr. Bhupesh from Dr. BKM Institute. Today we are going to discuss reading part A. So you guys have asked me to do this reading 15 to 20 and I totally understand 15 to 20 reading. But the question number that you have asked is 15 to 20. But what my method is or what best method of OET is first to find where in the reading part A where that thing has been given. So even if somebody says me to do 15 to 20 question, I still would like to carry on with the complete thing. So if I read this text, economy class syndrome, first thing, then it is talking about DVT, international flights, airplane, suggestions. So talking about DVT, deep vein thrombosis, economy class syndrome, suggestions, wear loose clothes. Text 2 is previous research, venous thrombosis, researchers in terms of absolute risk, New Zealand found frequency percentage. Two similar studies and research is given in part 2. In contrast, a Dutch study found no link. So there are various studies. In part 3, there are symptoms. In part 4, there are travel related venous thrombosis. And then there is again background method and result, talking again about bit of numbers. So numbers and percentage was in paragraph 2, but in paragraph 2 there was research, and in this also there is some kind of research which is population based. Sorry, excuse me for my health. Conclusion, the risk of the after travel is moderately increased for all the. So what I have done, I have tried to understand the topic. So in the first, they are talking about economy class syndrome, deep veins thrombosis, suggestions. Then they were talking about research. Then they were talking about symptoms. Then again, they were talking about some research. So basically, I try to find where the location is. So now when I go to this thing, this, yeah, okay, clear all drawings. Yeah. So clinical manifestations of DVT. Clinical manifestations should be A as per me. Clinical manifestations means symptoms. I don't know whether it would be easy or difficult reading, but I'm just telling you how do I do it. So I'm taking it that way. So yeah, clinical manifestation. I think that should be these symptoms. Otherwise, here there are no symptoms. So I will do it as C as far as I think. Let's see rest of the blanks. Almost 9% of the patient traveled for 2 months. So percentage word was given in the second, as I was saying. If 9% I could find somewhere, second 9%, 1%, but percentage word was here only. So if I have to do 9% and I'm not finding any 9%, is it given 9% over here? Any percentage over here? No, I cannot find any percentage. So I would like to do this as B, and there is no percentage. So B. So C, B, controversial research. Controversial means when they about controversial means opposite research. So opposite research, they have talked the word in contrast. So I would again like to do B. Then there's stiffness in the lower extremities. So that should be in the symptoms. If I can find the word like stiffness, tenderness, so that goes to C. That is what I'm saying, how simple it is. Visiting general practitioner before journey. Journey means before traveling. So travel word is here. And if I can find the word GP, then I would do this. GP word, GP word, GP word. No, it's not given over here. It should have been the flying, traveling by bus or to the here's the risk, but it is not talking. There is for travel people shorter. No, it's not talking about that. But otherwise, I was thinking it should be here only. GP word. So now when you don't find words like this, that is where you need to save time. So I am unable to find this thing. So now I should not, the main thing in the reading part A is to save time. So now I should not overdo it. So I have to let it go. One or two questions would be difficult, but I will find this GP word or doctor word later on. Remote travel and DVT are not related. So remote travel and DVT. Remote travel and DVT. So this also I'm not finding easily. Remote travel and DVT are not interrelated. So again, I have to leave this blank. That is what I am saying. The major thing that you have to save is time. In the part 1 to 7 question, 5 questions would be easy to find. Elder patients were invited in the study. So study was over here. So if they are asking for elder people, no elder people methods. We study the facts of the transport. Elder people, no, I could not find the younger than 70 years. Consecutive parents younger than 70 years of age. So I think this is the one fourth. So again, I have always told you, you will find only 5 to 6 questions in the party. Now I need your help to understand what I have done right and what I have done wrong. Can you help me, please? First is fine. C.
Yes, sir.
Three. Yes, sir.
B.
Sir, 4.
9%, either 2 or 4, but I could not find the word. So, to be honest, it was not that easy kind of a thing. It was not an easy part A, to be honest. Controversial research result should be B. In contrast, word was given.
No, sir, it's A.
How come? A, is it given? Some are divided. Okay, research evidence is currently divided. But in this case, even if you have done B, then also it's fine because contrast. I think you all would have done B, right?
Yes, B, sir. Yes, sir.
You can take because there is controversial word and that covers in contrast. So it's if it is not given over here, then by chance this divided word is given. So divided also means that their opinion is half and half divided. But I would better like to do this question as D only. Stiffness is C. Is it fine?
Yes, sir.
Yes, sir.
And GP word, I was little surprised. I could not find the word GP, but it
The
should.
first paragraph, last line,
Mm.
consult with your doctor before traveling.
Where is it
Yes,
given?
sir.
First paragraph, last line, sir.
Here it is. Here it is. So this I could have found. And remote travel and DVT are not related. Remote travel word.
Sir, second paragraph.
Second paragraph. Air travel has become more common. Have
Sir,
shown an
in
association, but they are no, not this one. Where exactly is it given?
Sir, in contrast, a Dutch study found no link
Last
between
line.
Oh, link
DPT and long
and long distance travel. Cool, but it is not an easy reading, to be honest. I normally reading at least 5 questions would be very easy. So in exam, you will find an easier reading than this. I guarantee you this thing. Elderly patients were invited. So 2 or 4.
4.
Second spot. And where is elderly patients given this 70 years of age? That was the
Yes.
thing that I had to
Yes.
find.
On.
Okay.
Yes,
Yes,
sir.
sir.
I would have taken the risk at least this question. So now you have asked me 15 to 20. Why do I always? I'm not saying in exam I will do these questions, of course, in the row 8, 9, 10th, 11th. But why did I do first 7 questions? To understand that where now sitting with the legs crossed is not recommended, while regular stretching and dash may be beneficial. So I have to find this word. So regular stretching word should be given in the precautions over here. Regular stretching and exercises. So exercises word should be my answer. Am I right?
Yes, sir. It's exercising.
So you
Yes.
asked me 15 to 20th question. Now I am telling you what is the use of doing first 7 question first. Now I can easily say this thing. Some studies were in dash to a Dutch study. In contrast,
Yes, sir. Contrast.
that word I
Yes,
just did in contrast. So again, I did not have any problem if you can understand in contrast. So it's just so simple. You have to just fit in the word. And if you ask me, sir, why did you do this? That is why I have always told you go for your preposition in. Now you will say, now you can see the preposition in contrast after in. That is why prepositions are so important. I'm telling you, difficult questions can be done with prepositions. Now I will do another question based on a study of dash patient 2000 and they are saying 1996 patients, something like that. So you
yes, sir.
under 2000 or almost 2000 or approximately 2000. You can fit in any word, but the best word I would like to fit over here is under because under means or less than 2000. So under or less than or below. These three words are the best word because 1996 number is less than 2000. So I will say is less than. So based on a study of less than 2000 patients or below 2000 patients, or under 2000 patients or almost word is also good, almost 2000. So final word I would like to write is almost, but I can write any word, you will get the marks. Despite conflicting, some airlines take a pro. I could see the word, evidence type words, despite conflicting studies, research. So I have to find the word. So despite conflicting types, some airlines have a proactive approach. Approach word is given somewhere. Approach word is given. No, two similar studies reported the risk found. So this question is difficult. I would not like to do it first. So I'm leaving this question. That is what you need to understand. Save time. But otherwise, 15, 16, 17th question were easy for me. This otherwise, I will say despite conflicting conclusion or studies. Because contrast study means either I can fit in this word or I can see conclusion. Yeah. So despite conflicting studies, I cannot fit in any word. So that's the only word. Bus travelers with dash who were overweight were taller than 190. So now I have to just find the number 190 centimeter. Here is the number 190. And now I have to fit in the word bus travelers with preposition is given.
with the factor wheel leader.
Individuals with factor
Sir,
wheel.
factor written in fourth paragraph.
Again, my preposition is becoming handy. So I use the word factor wheel hidden after with. So that is how you make questions easy. What I did, again, I'm telling you, what I did is I did not do this question, which was hard. Otherwise, it is going according to the prepositions and in, of. Then most significant symptom linked to DVT is symptom word was given over here. So now I have to fit in the word. Most significant symptom linked to DVT is the most important sign is tenderness in the calf. So that should be my answer because it is the most important sign. They have used the word most. So again, I am matching the superlative degree most, best. So these words are matching. So tenderness in the calf. Now I am having only this. I would either put the word conflicting studies or conflicting evidence because evidence word is a common word that comes. So now you can tell me answer of these. 15th is right. 15th,
Yes, sir.
16th is okay.
Yes, sir, it's right.
17th is okay.
Yeah,
Almost
Yes.
1,000 patients.
almost
sir.
nearly under.
Nearly approximately, yeah. And despite conflicting studies or results or evidence,
Evidence, evidences.
this blank you should remember anyhow because evidence word is a common word that comes after conflicting. It is a very common word. So this is the only fluke. By chance, I got it correct. Bus travelers with factor wheel hidden, and this is tenderness in the calf, right?
Yes, sir.
See, my things became easy because I know symptom would be given in 2 or 3. Sorry, symptom would be given in 3. Then I knew bus travelers with 190 centimeter. So I already see that numbers were given over here 1996, 190, 30. So they were given over here. Based on a study of 2000 patient, 190 is 96 number I was remembering, so I just did it. Then some studies were Dutch word. I could see here Dutch word, so I had to fit in from here. After in there was a word contrast, so I could do it easily. So that is how the things are done. And even if you ask me, 15th question was easy because I know they are talking about that thing, that suggestions, that dash are important. So suggestion word was given. Sorry, excuse me for my health today. Yeah, so they were actually talking about this thing. So that is how you need to do. So these were the suggestion: keep your legs crossed and this and this. So that is the most important thing in reading part A to save your time, that you try to understand where it is given and then you execute according to it. So that's the best technique. Never leave first to 7 question. Most of the people do this thing that they leave the first 7 questions. Never leave first 7 questions. You have to go by 1 to 7. Out of the 7 questions, 5 would be easy. You do 5 questions first, which are easy. Leave couple of questions because they will be hard. You will find the word like doctor easily afterwards. And then you can do that leftover question as well. That is how you should do reading part A. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256. Thank you guys. Thank you.